Hi there, my name is Columbian Minhas. I'm the respiratory therapy supervisor here at Royal Columbian Hospital, and I'm here to introduce the video laryngoscopy device called the GlideScope core system. This device allows our clinicians, our physicians, to put airways in our patients to rescue their breathing, different from other conventional methods that we have available. So this device can be viewed through a monitor. What's amazing with this device is patients that have very difficult type airways, we can visualize more effectively compared to other types of methods. And of course, in the COVID type of environment, we want to protect ourselves and the physicians, of course, by not being in the patient's face too much because there's a risk of exposure. And so this allows the clinician to be further away from the patient's airway and hence protect themselves. So to demonstrate how this works, this device, if you look at it, is connected to this monitor. And what we do is we insert this blade into the patient's airway. As we go down, we are able to identify structures of the patient's airway. So as you can see here, there's two holes basically. The one is the esophagus, which is where we don't want to go, and then the trachea, which enters the lungs. So the goal is to put the tube into that hole. So as you can see, I can get a beautiful picture, HD quality screen here to put the tube down. Patients would need airway support because they can't breathe on their own. So there's many complications patients may come in with. For example, traumas. They may come in with through a motor vehicle accident where they can't breathe on their own. We have many patients that come in with cardiac compromise, and that results in them not being able to breathe effectively. And we treat patients throughout the hospital from, the baby world to the adult world, and this device works through all those patient populations. So COVID often causes respiratory compromise in patients, and we've been seeing that quite often. Their oxygen levels are going down and they need our support beyond what we can provide with just simple masks or simple oxygen therapy. So we have to put a breathing tube in them. And this is where this device is so important. I'd like to thank all the donors for supporting us and getting devices like this and this amazing technology, because without this, it wouldn't protect us as clinicians, and it also helps the safety of our patients as well. So it's incredibly important to have this type of technology in this world, and from the bottom of our hearts, we truly, truly thank you all.